This topic is on how to manage diabetes with the nutrition. In terms of diet and nutrition, how to solve the issues. Just now we talk about the insulin resistant, right? So basically, insulin resistant is because your keyhole become rusted. Rusted. Become rust. Rust, what you need to do, your body become rusted. Your body rusted is actually due to the effect of free radical. Free radical causing an effect called oxidation. So you need to antioxidant. You need to give your body a lot of antioxidant plus in order to neutralize the oxidation and prevent oxidation. So this will actually solve your insulin resistant issue. This will actually solve your insulin resistant issue. So how much antioxidant to give your body? That one is clinical practice. Clinical practice means like a doctor have to judge how much medicine you need, how strong medicine treatment I need to give you. So that's clinical experience, clinical experience and clinical judgment, which you need usually you need a doctor to do that. That's why I'm here. I have 10 years experience of nutrition experience. I have 10 years experience of using diet and nutrition to treat various patient illness. So if you have any issue and problem, do not hesitate to contact me. So I will follow up your case. Yeah. All right. Next. Okay. So how? But this one will take time. Take time to unrust. How to increase your insulin sugar level faster? Number one, reduce carb absorption. Reduce your gastric emptying. Mean delay your gastric empty. Mean you slow down the food passing through your intestine. So the absorption will be slow also. So this one is achieved by what? Your natural food. Fiber. High fiber diet. High fiber diet is actually reduce carb absorptions and gastric emptying. So your carbohydrate absorption will be slower, and usually your sugar level after food went up like that. So if you give fiber together with your food, with your rice, it wouldn't went up like that. It will went slower. It went up slower. Okay, or if you usually only take pure carbohydrate, it went up even faster. So if you have high fiber, it will become slower. The sugar level will increase slower. So this achieve your medicine effect. But how much fiber you need? Again, this is a clinical experience. Next, nutrients. You want to increase sugar consumption. You want your body to use sugar faster. This is actually insulin effect. Because your insulin asks your body to use sugar, right? Actually, there is a way you can achieve insulin-like effect, which increase metabolism. Increased metabolism will consume sugar faster. How to increase metabolism? Yeah, exercise vitamin vitamin B basically. Coenzyme Q10, multivitamin. All this can increase your metabolism. Yeah, so this will reduce your sugar faster. Yeah, because it can carry insulin-like effect. Because it increase consumption. So another thing is increase satiety. So you don't eat so much. Actually is protein. If you have high protein, so you don't get hungry so fast, then you won't eat so much. Yeah, there's one of the theory of the diabetes. It's called type 3 diabetes. Is your intestine. This is your intestine. Yeah, this is your intestine. So usually they have cell very tightly tied over here. Yeah, very close. Yeah, so nothing can enter. Cannot go in. Like that. You must go through the door and go out from the door and enter the body. Yeah, usually it's like that. Usually it's like that. So what happened is your intestine become very loose. Yeah, so things will escape inside. All the toxic will escape inside. All these toxic will form free radicals. All these free radicals will cause insulin resistance. And also your sugar can go in very easy. Your sugar. Yeah. So actually your body, if they think that your body already have a lot of excessive sugar in your bloodstream, actually your intestine cells can block the sugar absorption into your body, too much sugar. But because of this is called leaky gut syndrome, the gut is leaking, so the sugar can go in, poison, toxic all can go in very easily. So one of the things, we think one of the cause of diabetes is because of that. So because probiotic can actually repair all these things, so we usually give probiotic to the I usually give probiotic to my patient. So there's a lot of diet program out there. So basically the concept, I just tell you the principles, or it's called carbohydrate intermittent fasting. So usually I recommend at night when your moon rise, you don't consume carbohydrate at all. So you're allowed to take some rice and noodles during daytime, morning, or lunch. If possible, lunch also you reduce. Only night you don't consume. So you only consume what? High. You take more protein, increase your protein intake, increase your fiber types of food intake. Yeah, these two. These two. Don't reduce chemical food. Right? Today I'm not talking about the chemical what is the natural food lah. Last few weeks I have already spoken onto the clean eating. So reduce chemical, reduce oily food. Yeah. So this basically will usually increase fiber intake. I will recommend juice, brand juice, not juicing. So you need to take the leftover, when you blend the leftover, all these rough things, juice, swallow it because it's all the fibers. So I usually recommend juicing for those who have diabetes, to increase the fiber intake. Then you can mix the protein powders inside the juice. Conclude how to treat and manage your diabetes with nutrition.